everyone, my name is Durva, and I'm honored to be sharing my research with you today as a part of the Global Health Leaders Conference. In my project, I explore how school education and access to proper facilities affect the way adolescents manage their menstrual health. More specifically, I looked at how these factors influence their confidence and attendance in school. Okay, so a little bit about me. I'm a rising senior at Notre Dame High School in San Jose who's passionate about public health and biochemistry. I'm the president of the South Asian Student Association, a captain and choreographer for our school's Bollywood dance team, teach Indian classical dance, and cheerlead at school events. Outside of school, I'm a UCSF Care Registry Ambassador advancing Asian American health research, and a founding board member and outreach intern of Up Next Scientists, a nonprofit promoting STEM education. My research includes a menstrual health survey in Maharashtra, India, and a co-authored paper on Asian mental health through a UCSP program. Currently, I'm at Boston University exploring data science applications. Looking ahead, I hope to create meaningful community-based change. Before diving into my research, it's important to understand what menstrual health management actually means. Menstrual health management, being one of the most overlooked topics, refers to the ability to manage menstruation safely and with dignity. This includes having access to clean materials to absorb menstrual blood, a private and hygienic space to change and dispose of those materials, and adequate soap and water for hand washing. It also involves receiving accurate and sufficient information on how to manage menstruation and being in an environment that supports dignity over stigma. Menstrual health challenges aren't limited to one country, they're a global health issue. In the United States, two-thirds of low-income women can't afford basic sanitary products. In Belgium, nearly half of women living in poverty face the same struggle. And in Australia, 3 out of 5 women report difficulty accessing products. In Niger, only about half women have private spaces to change, while in Brazil, 1 of 4 girls miss school because they lack hygienic materials. Lastly, in Nepal, 2 of 3 women avoid daily activities during their periods. These examples show how menstrual health is deeply tied to poverty, education, infrastructure, and cultural norms around the world. Zooming into adolescent menstrual health, the gaps are especially evident in school settings. Currently, 69% of schools don't have bins for menstrual waste and toilets, making proper disposal difficult. Even more concerning, 664 million children around the world are not provided with basic hygienic services. On top of that, 61% of schools don't offer any form of menstrual health education. This means millions of students are left to navigate menstruation without knowledge or support they need. Let's take a closer look at India. India is home to over 20% of the world's adolescents, yet many still face serious barriers when it comes to menstrual health. 71% of girls say they didn't know about menstruation before their first period, and girls miss up to 20% of the school year due to menstrual challenges. Additionally, 23% of girls drop out due to lack of functioning toilets. Maharashtra, in particular, being one of the most populous and diverse states socially and economically, is majorly understudied due to data collection issues. These include, but are not limited to, inadequate resources, challenges with access to rural areas, insufficient healthcare funding, and cultural and educational barriers. These factors made Maharashtra a compelling site for my study. As mentioned before, the study looks at how menstrual health education and access to facilities affect students' confidence in high schools across Solapur, Maharashtra. The city Solapur was picked due to its diverse human population both economically and socially. The study was conducted across 5 schools with 96 voluntary participants, aged 13 to 23. It used an 18-question self-developed survey designed specifically for this research. The study was carried out by a public health nonprofit organization. The study focused on addressing 2 central research questions related to the effects of comprehensive education and adequate bathroom facilities on confidence in their ability to manage their periods. The key findings related to menstrual education sources were that the percentages of adolescents learning from the internet, which is 20%, is lower than expected in today's technological world. This reflects regional limitations, as 43% of Maharashtra students don't have access to the internet. Due to the digital divide, there are major gaps in knowledge related to the latest medical information and media literacy. The findings related to school facilities show that 25% of schools lack rest areas, which is shown to have an impact on attendance. 16% of students wait until home to change materials, while 23% miss school and 40% skip extracurriculars. In addition, 39% avoid physical activity, showing that expanding accessibility in all categories is critical. Focusing on one school from the study where the correlation between facilities and confidence is evident, it was reported by 85% that the school doesn't provide period products, and 95% reported that materials are never available. As a result, all respondents said they wait to change materials at home and avoid physical activity. Relating to social discomfort, Although 75% report receiving education before their first period, 39% report still being uncomfortable discussing menstruation in school, and 14% report withdrawing socially. This shows that the discomfort can be attributed to social settings over educational insufficiencies. To fully understand the causes, it's important to study the cultural and religious context. The history of menstruation has roots in mythology, as it's known to be a transference of sin to women, enforcing the idea of impurity and legitimizing restrictive menstrual practices. These include, but are not limited to, the idea that menstrual rags contain harmful energy, women must be secluded in huts outside of villages, and they may not have contact with males and elderly family. Despite all the efforts made by policy, many of these practices still continue today. In conclusion, menstrual health challenges, including supplies and education, directly affect health and participation. Stigma also plays a role, but is often overlooked. The lack of supportive infrastructure further impacts menstrual health, with all of the stated factors leading to absenteeism and directly leading to gender inequality by limiting educational opportunities and disproportionately impacting marginalized communities. With consideration to all of those factors, it's crucial that evidence-based policies consider culture along with infrastructure and education. This includes upgrading infrastructure along with utilizing culturally sensitive dialogues to normalize menstruation. In addition, expanded education curriculum is needed to create inclusive environments in schools. These are the references that were used today. I would like to thank my mentor, Gracie, and the Dr. Mayton Foundation for all their help. I would also like to thank the IRB for reviewing my research and the GHLC for this opportunity. Lastly, I would like to thank all of you for listening. Here's my contact information if anyone has any further questions. Please don't hesitate to reach out. Thank you so much.